Well, thanks for joining us and welcome everyone. Pastor Randy is going to tell us who's here.
Well, we have an amazing team. We've actually assembled, we have someone here who has a subscription to the National Enquirer. And then we also have someone who knows someone who had a cousin that had a bad cold, but turned out to not be COVID. And then lastly, there's someone who watched the news for 24 hours straight, and they're writing a thesis on this. No, actually, we have some amazing healthcare professionals with us right now. So Deslin, why don't you begin? If you guys would just introduce yourselves and what you do.
Yes, hi, I'm Deslin Olanuga. I'm an internist by training. I work at the Atlanta VA Medical Center. I deal mostly with geriatric patients. I'm also a clinical instructor for the fellowship program in Emory. I've been with the VA for about 20 years.
Scott?
I'm Scott Keller, and I'm a family physician in Lilburn, Georgia, and I work for Emory University. I'm an adjunct assistant professor of medicine there.
And you head up our Grace Village.
Grace Village Medical Clinic, I'm the medical director in Clarkston, Georgia.
And Jenny?
I'm Jenny Balfour, and I'm one of the nurses at Children's Healthcare of Atlanta. And I take care of children, newborns to 21 with any kind of heart defect or anything wrong with their heart.
Noah?
Hey there, my name is Noah Fouts. I'm a pediatric nurse practitioner. I currently work at the Pediatric Intensive Care Unit at Scottish Rite at Children's Healthcare of Atlanta.
And Donna Fay, who has been our designated nurse on more missions trips than anyone else I know.
Hi, I'm Donna Fay Sowell. I'm also at Children's Healthcare. I'm on the Eggleston campus. I've been in the NICU there for around 40 years.
And Robert, introduce yourself.
Hello, Grace New Hope. This is Robert Soa. I have a PhD in microbiology, and I work with the EPA here in Athens, Georgia.
So let me just ask you guys, what would be the practical advice you would say in terms of what you would do? And Robert, I'm going to come to you in a second and ask about what are practical things you would do to avoid getting COVID. Noah, let me start with you.
Practical things would just be wearing your mask when you're out and about, washing your hands, taking the necessary precautions that we need to take, just because like any other virus, it's out in the environment. We can't see it. We know it's very contagious. And remembering when you are wearing your mask, you're actually protecting others from yourself. So that's why it's really important that a lot of us, or all of us ideally, wear masks so we can protect each other from each other. Because unless you have a correctly fitting N95, you're not protected from other people necessarily with just a simple mask. So we, as a group, as a congregation, we need to wear masks to protect ourselves and protect our friends from the virus as well. And just washing your hands and doing the things, just being conscious about the things you're doing and cleaning every day.
Well, that's a very controversial thing you've said there about wearing a mask. Let me just ask you, is there anyone here that would disagree? Is there anyone here who thinks that masks are not important? Does everyone agree, as medical personnel, as medical people, or biologists, that you think a mask is an important thing?
Absolutely.
Absolutely.
Donna Fay, you were saying a little bit more even just about that the mask isn't so much about protecting you as it is protecting other people.
Right, and as Noah said, unless you have an N95 mask that's been fitted to you and tested, the mask is not giving you 100% protection, not even close to that really. It's more out of care and concern for others that you're wearing the mask, because you might have COVID and not know it, but the mask prevents you from spreading the virus to other people. And on the other hand, if you're wearing the mask, to me that says you care about me. You're covering up so that you don't risk exposing me.
So Deslin, the difference between symptomatic and asymptomatic spread, a lot of people ask questions about that in our Facebook thread. Could you just kind of speak to that a little bit?
Yeah, so the symptomatic spread, what that basically means is that you have the symptoms of COVID, whether it be fevers, chill, muscle aches, and you're highly contagious. And you are able to spread it within 1 to 2 or 3 days of having your symptoms. Asymptomatic means that you have no symptoms. You are a carrier. The concern with carriers is that they can actually spread the COVID up to 14 days of not knowing that they have the infection. So that's the difference between the.
This is why we would all want to wear something. It isn't
Yes.
just for protection for us, even if we think we're not going to get it. This is about protecting other people.
Exactly.
And Robert, how does washing your hands help against something that's this vicious?
It's because, we know, the science shows that the virus, can stay on surfaces. So when you're going about, using common areas or touching surfaces, you are likely going to pick up, the virus on your hands. And so it's very critical that, to be able to wash your hands, and the CDC recommends at least for 20 seconds, so wash it thoroughly with soap to get any remnants of the virus, on your hands, off. And if you cannot do that, or you don't have, soap and water to wash your hands, then, if there's any hand sanitizer available, then you can use that too. And also make sure that you rub it in for at least 20 seconds, to disinfect your hands. And then once you get back, home or to a place where you have access to water and a soap, then you can just go ahead and then, wash your hands. And as Noah said, it is, one of our safest defense against this virus.
No, I do want to just commend, we've been doing student ministry things, and I just want to commend, your daughter's been faithfully wearing her mask, and it's really sweet. And we've been doing all that outside. Let me just ask a couple of really practical things here. And Scott, I want to ask you this. If you feel like you have some symptoms, what should you do? You have a fever or those kind of things. What should you do?
Fever, chills, short breath, sore throat, the number of symptoms they talk about with COVID. Number one thing is to quarantine yourself from your family. Don't go to work, don't go to school. Secondly, there's trained nurses and physicians and nurse practitioners and PAs on some of these hotlines. The CAB, Gwinnett Health Centers have those. Emory has those. Call the COVID hotline and tell them your symptoms. And depending on the severity of your symptoms, then they'll tell you when and if you need a COVID test. And then go from there. Now, if you have shortness of breath, have trouble breathing, severe symptoms, they may want you seen right away someplace.
Noah, what you work with students, younger people. I would assume there's some asthma things in there. What's been going on with asthma? A lot of people have been asking about this. And again, I'm not asking you guys to circumvent anything that anyone's physician would say, but if you're having shortness of breath, what should you do?
Well, pertaining to asthma, and I can only speak for pediatrics, we have seen actually very few pediatric asthmatics during this pandemic, probably because we're not all together spreading the normal viruses that normally, and they're all inside a lot more too. So all the allergens, the common viruses that go around that usually make kids with asthma wheeze just aren't getting circulated because we're being more socially distanced.
That doesn't mean go crazy and run out.
No. And as Dr. Keller said, if you're having, no matter your age, if you're having any new shortness of breath, however, if you have pulmonary lung issues or not, if it's a new symptom, especially if it's along with other symptoms. And you probably heard there's a bunch of symptoms that can go along with COVID. You need to reach out to someone for guidance, like one of the COVID hotlines. And if you think that your symptoms are very severe, then you need to be seen immediately.
And Des, I'm going to ask you something, then I'm going to ask Jenny kind of the opposite ends of the scale. Deslin, if, it seems like the death rate's going down, containing, but there's more people getting sick because it seems like it's a lot of young people. Concern there might be that young people would bring this home to grandma or grandpa who are living with you. Any special things to be aware of if you got older family members living in the house? You're muted, Deslin. You're muted.
Okay, so what I recommend with my geriatric patients who have family members that go to work, I always tell them, when you get home, the first thing you do, you take your clothes off, put it in a plastic bag,
You go to your
take
room
a
before you do
shower
that. That's
before,
important.
exactly, before you interact with your family members. And also, I recommend that my elderly patients, that they stay at home, that they avoid going to places with large crowds, just to prevent their risk of getting the COVID-19.
And then Jenny, kind of on the opposite end, what do you watch for with children? And is it mostly fever? Is it crankiness? What is that you would watch for with children? They can't.
I would defer to Noah on that. I'm not as familiar with those.
Okay.
Please.
What would you say, Noah?
Well, unfortunately, a lot of children are asymptomatic. Actually, a lot of the kiddos that I've seen in my ICU that were COVID positive were actually there for other reasons. And they just happened to be tested, like if we get them from an outside hospital, but they would have no like classic symptoms of COVID as we think, with the respiratory issues, the breathing problems, the fevers. Now, yes, we have had a handful of children with active COVID, kind of like the adult version. But a lot of kids can be asymptomatic. So for all the parents, again, just following those precautions and educating your kids about that as well, because while they are at a much lower chance of having active disease, being symptomatic, they can definitely be carriers to you or to an older family member.
Let me just ask, there's a lot of anecdotal questions here. Vitamins, is vitamins a good thing here? Any thoughts on any of that? Jenny's got hers right there.
I would highly recommend vitamin C, vitamin D. These are all going to boost your immune system. Vitamin A, and then a form of like an echinacea complex. These will all boost your immune system, and they're highly recommended by what the material that I've read. And also, I'll go back to why I deferred to Noah, but he hit the nail on the head. We have had COVID positive in our cardiac population, but they presented cardiac symptoms, congestive heart failure, poor heart function, and they're so sick at the ER door, and that's when we are seeing them. And like Noah said, they're being seen for different reasons, and they have tested positive COVID.
Different symptoms there.
And everybody has to remember, this is a bat virus that married a human virus, and it's very unpredictable, but we do know it's extremely contagious, and there are things that you can do, like hand washing, not touching your face, masking.
Donna Faye, you were going to say something there.
I was going to say the infants that we have seen, it's been the same as what Jenny and Noah were saying. They were not in for any COVID symptoms. They were in for another reason and were tested and found to be COVID positive. So it's really tricky with kids.
And Jenny, you were talking about vitamins. I think this goes without saying, but sometimes common sense, you should do that in the recommended dosage. Taking the whole bottle of vitamin C is not a good thing. So
Well,
just to be-
vitamin C, your body is able to rinse it out. So it's hard to overdose on vitamin C. If Dr. Keller or anybody else wants to chime in on that.
Gets you expensive.
What'd you say?
sense.
It makes very
Common
expensive.
sense.
So let me also just lastly, for teachers, anything beyond, any of you guys have any advice for them? Because it seems like students, even though they may have the virus, they're probably going to be okay. But we at New Hope, something that really kind of got my attention, we had a 57-year-old man, my age, very physically active. I'm very physically active. I cycle and stuff and all that. But a 57-year-old man went from no symptoms to dead in 7 days. And it really kind of got our attention. And I mean, it got my attention that we need to take this really serious. So I think there's students is one thing, but then for their teachers, is there anything beyond what we've said here that maybe we could give hope for our teachers or advice to our teachers? You think anything, Scott?
Well, just the fact that they need to do the same kind of precautions that the rest of us do. They need to be wearing their masks. And I think in our county, the kids are supposed to be wearing masks as well. And maybe they can make the masks fun. I don't know. This is going to be a tough deal for them. But the teachers need to be extra cautious because, like everybody else was saying, these kids could be carriers and have no symptoms. I don't want to scare people. They just got to be careful. Wash the desk, wash hands.
Lastly, so just moving now, I think, to what we're going to be doing as a church, and how we're going to move. And speaking of what we're going to be doing as a church, Anita just brought me coffee, so now it feels like church. So with marshmallows in it, Anita? Caramel foam. Wow, it's a latte. But which I don't know that it has any direct bearing, but I'm sure coffee makes it better. What would you say, maybe whether you go to what we're going to be doing at New Hope based out of those concerns is we're going to be moving most everything outside. Seems like it's somewhat safer outside. I guess the virus is not as contained there. Is there anything else that you think we need to be telling people from the church about this? You have any thoughts, Deslin? Anything else we should be telling people?
My recommendation for our family, our church family is, if you're sick, stay home. Stay home, and you can join online and worship and fellowship online. But that would be my first thing. If you have any symptom that could possibly be COVID, because we always say you're COVID positive until proven otherwise. And so if you are sick, I would recommend that our church family stay home just to protect everyone else.
And by the way, just please call us. Please let us know. You can always email hope@gfc.tv. Anita and I have gone around to the outside of homes and we've prayed over homes a lot. We won't forget you. We'll stay engaged with you. And we, there's your church family wants to be there for you, but we also want to do this responsibly and protect our children and protect our workers. Anything else before we wrap up? I've got a quick little word here at the end.
Randy, I would say one thing, it's an opportunity for service. My mom's going to be 90, her birthday in August. She's not really close by to me, but it has been so helpful that people in her church go and pick up her groceries for her because she does not need to be in the grocery store because of her age and some other things, health issues that she has.
That's great.
So people that are at lower risk and are going to the grocery store anyway, check on your older neighbors or those that are immunocompromised, people that really do need to be just staying home. It's a great opportunity for the church to serve.
Amen.
Anything else?
I have one thing. I think all of us that are talking, we have since day one not been furloughed, not missed too many hours at our jobs. We have been frontline. We've been exposed. We've been diligent. We've had a little fear, but we've been diligent in all the practices that we've been taught to do, and we are all, knock on wood, COVID free. So
And
do not
I was going
fear,
to
just
actually
be
mention
diligent.
that I'm just so thankful. First of all, you have been prayed over, all of you, by
Well, we
name.
feel it. We feel it.
But I do think this is a sign. I mean, our healthcare workers are out there every day,
Mhm.
exposed, but you're doing the things you're supposed to do.
Right.
And
One thing I recommend to teachers is start wearing your mask all the time. When we walk in our hospital door, we put on a mask and we do not take it off until we leave. So a practical thing, I mean, most of you are not used to wearing masks 12-hour shifts. So for teachers that are going to be have to doing it, I mean, start doing it. Start getting your acne on your face, because it's going to happen. And also, everybody out there, don't wear gloves to the grocery store. You're doing more harm to yourself and to others in passing any kind of germs, putting gloves on. That's like,
Yeah, I carry sanitizer with me, and I'm using it like 5 or 6 times in the
better.
grocery store. So, well, I just want to share this one thing, and I'm teaching on this Sunday in Jeremiah 29, when they're in this place where they're in the exile, and it feels a little bit like we're in the exile right now. Feels like we're kind of in this place that none of us want to be. But Jeremiah says that while you're in the exile, plant trees, build houses, get married, live. So there are things that we can do in this season that are different. Noah, you guys are at the beach right now. We can do some things safely, and we can live, and we should live, because the way we carry this in front of our children is really important. And God did not give us a spirit of fear. Jesus didn't jump off the top of the temple. You don't put God into a foolish test. But on the other hand, we don't need to live in this spirit of fear. And I think the fact that all of you guys have stayed healthy in the midst of this is a great testimony. Do the right things. Do the right things. So anything else before we close? Myrna, you want a final word? Or
Thank you, Pastor Randy, for convening these health professionals. And thanks to each of you, how grateful we are that we have such caring health professionals in the Grace family.
Thank you guys so much. Really honored and thankful for all of you.
Thank you. Thank you.